today with Tami Fishman and Ofir Goldstein from our Meritas affiliate in Israel. Tami, Ofir, how are you guys doing?
Great.
Happy to be here.
Thank you so much for accepting our invitation and helping show the breadth of Meritas' scope in this industry and the knowledge and expertise that we have. I think it's great to have you guys on board because as I think I may know anecdotally, Israel has been at the forefront of some of the medical research for decades, really. And so that really was important for me to get insight from the both of you, because I'm looking to understand, given that you guys were so far ahead of the curve many decades ago or years ago, where are things at today? What is the current state of legalization in your country?
Okay, so I'll start, and I think we need to separate between medical cannabis and between recreational cannabis, and there's a significant gap between the two. In Israel, the Ministry of Health established a division that is in charge of licensing medical cannabis. There's a very detailed book that is called the Green Book that sets all the regulations. Using medical cannabis has been divided into 5 steps. Each company can operate only in one of these fields, right? So we have the growing and the manufacturing and the shipment and the sales and the consumption are all separated into different categories. And for a company cannot be involved in it can be involved in more than one step, but it needs its own permit for each part of working in the medical cannabis world. There are more than 100 companies right now that are involved in these different segments of medical cannabis. There's regulations about importing medical cannabis into Israel. There is reform, and Ofir will soon update and give some more color about exporting cannabis, which is the last chain, which is still in progress. But I think a lot has been done, and we see companies settling in. I do have to say it's all still new, so we still have a lot of questions that we have to pick up the phone and ask the regulators, and it's all still being built and learned. And the market is developing, the science is developing, and so the regulation is being updated. For instance, we have a regulation saying for which indication cannabis can be prescribed. A physician can't just prescribe it for any indication. So there's a list of indications. This list is being updated regularly based on the science and the research that is being conducted. And we slowly see more and more indications being added into this list. So I think that in the medical cannabis, we're doing pretty good. The regulations from the legal perspective are robust, and companies have a feeling that they know what has to be done. Ofir, do you want to talk maybe a little bit about the export or anything else that I left out?
Yeah. I would just say maybe to add that alongside with these steps in the supply chain of medical, from grow to sell, there is also regulations for research with medical cannabis, meaning any research that involves or use medical cannabis as part of the research or the clinical research. So that's also one more issue that is regulated in Israel. And if we need to talk a little bit maybe about export, so companies in Israel wanted to be able to export medical cannabis outside of Israel for a long time. It took a little bit of time for the Ministry of Health and all other agencies to be able to produce and provide guidelines. It started not too long ago, in October 2020, they issued a pilot program allowing for several specific companies that deal with grow medical cannabis for medical purposes to export cannabis outside of Israel. And not too long afterwards, the IACAR, which is the Israeli Medical Cannabis Agency within the Ministry of Health, published its regulation regarding export of medical cannabis, basically saying that if you want to export medical cannabis, you need to receive a specific license for that. But one of the most maybe important requirements to do so is to ensure that there is sufficient quantities of cannabis to the Israeli market for like stop. Like if there is enough, you can export, but first we need to look out for our patients. So I think that just like in a nutshell regard on import.
No, and that makes a lot of sense to have that the regulator having that control. And just following up on that, do they keep track of the amount produced, cultivated? For example, here in Canada, there is a reporting system where you have to. So the regulator here has a general sense of the amount of cannabis in the market or that's being produced. Is Israel the same or similar?
I think so. There's no publication regarding the amount, but I think that the IACAR is like keeping track on the amount.
That they have a software that actually follows them, from the plant till the end product, so they keep track of where was how many plants were grown and how many end products you end up with. So yes, and there is some kind of keeping track, but again, it's not something that there are any public records or we have any visibility to. So yes.
And another question that I have stemming from the answer to the question was, where do currently patients access their cannabis? I like in Canada, it has to be online, direct producer to patient. In other jurisdictions, we've seen dispensaries, some pharmacies are doing it. So what is, if you're a patient in Israel, what are your options?
Okay, so I'll be happy to answer it. So there's the old system, which was changed, and we'll talk about it later. But the old system was a patient filed for a permit for his own license to go and purchase that approval. He used to submit it directly to the Ministry of Health. Once he got such an approval, there were certain companies that he was able to go and purchase a specific, and actually patients liked it because there's still a differentiation, between the products, the end products, and a different company, even if the concentration is the same and what's on the label is the same, there was still a different effect. So they liked it that they were able to go and purchase their cannabis products from a specific company. That was the old system, and it's still available. I mean, patients can still apply directly to the Ministry of Health, not go through a physician, but I think it's a slower process. Another process is that there are physicians that have gone through a certain training course that was offered by the Ministry of Health, and they're authorized to prescribe medical cannabis just like any other medication, just like you can prescribe antibiotics or anything else. And then a patient goes with that prescription. There are either dispensaries that are solely for medical cannabis products. There are companies that operate pharmacies or dispensaries only for medical cannabis. And there are also certain pharmacies or even, like larger farm that have also other farm like you'll find their cosmetics and like that have a pharmacy that have a license to sell medical cannabis products there. But again, when you go with this prescription to the pharmacy, it's harder to say I want I want this and this company's product. Usually you get what's there. So there was some criticism from patients that were used to a certain product that they have to move to the system and then they don't know what they're going to get. So I think there's still a balance between the two regimes. Ofir, anything else that I didn't cover? Or yeah.
That's basically the two ways to purchase cannabis in Israel. Medical cannabis.
Medical.
Medical
so that leads
cannabis.
to the next question is so we have a medical cannabis regime very clearly delineated from the recreational. What is the recreational regime, if any?
Right. So where Israel is going is to maybe not allowing it, but decriminalizing it, saying so in 2019, the law was changed that you have three strikes of self-use of recreational cannabis. So the first two times that you're caught, you will only get a fine for using it, and then the third time it's already an offense. But it's definitely not something that is permitted. I don't know how much the police is actually enforcing self-use. They are definitely, we see it almost daily on the news, that they're definitely enforcing against the growers or the sellers. That is something they're aiming still to enforce and to catch. It's not legal. It's something that is often discussed. We can talk about, when we reach the part of where we're headed, we can talk about that. There's a very strong lobby for decriminalizing cannabis use for recreational purposes, but it's still illegal to use it in Israel.
And so, before we talk about where we're going, I'm always curious to know how did Israel get to its current state? So as you mentioned, there was an older regime. Did that older regime accompany older rules, older legislation, gaps in legislation? What is, in a relative nutshell, because I know we could probably talk for hours about the path, but what is the path that Israel has taken from a cannabis legalization or regulation point of view? And again, I know the medical is at the forefront because it's what's currently legislated and regulated. But what is that trajectory? What did that look like, Tami or Ofir? That'd be really interesting to know.
Yeah. So again, as we said before, cannabis is a dangerous drug, and it used to be treated just like any other drug, right? Heroin or cocaine or anything else. Then I think as research progressed and it was made clear that using cannabis for medical purposes can really help. Slowly a shift started in 1992. The first single permit, for a single patient to use cannabis for medical purposes was granted. And as I said before, there wasn't any clear legislation or regulation then. What you did was you sent a fax to the Ministry of Health, and there was one physician there that he or she were supposed to, review all these faxes and give the permit. And again, as research and also the mindsets of people changed, realizing this is it's not a drug. It's really something that can be used for medical purposes. As the shift started, then there were just more and more faxes coming in. I remember visiting, the Ministry of Health, and I think it was around 2015, and they showed me there the piles of faxes that came in daily. It was something that they couldn't handle. It was impossible to handle, and I think that's when, around that time, really, they also started the reform. And the Ministry of Health had this idea of really putting all this detailed regulation, and they started with regulation first, right? First we had the regulations, and then slowly the industry came in after the regulation started. So it was very interesting to see how the regulation was there even before the industry accepted. It took the industry some time to accept it because they were used to these personal permits. There was a real debate about the exports. That was a real issue. It's still not finalized because there's always the scare that, so long as the growth and development is for the local market, it's still smaller amounts. It's a small country. That is something that can be controlled. Once the export is allowed, then the amounts are going to be significantly higher. That's the expectation, and there's the scare of not being able to really monitor it and be on top of it. So I think that's where we started. Again, Ofir, I'm happy to hear your insights.
Well, I agree with everything you said. Just in April this year, there was more than 91,000 active license. So the demand is high, and the Ministry of Health needed to change something because he couldn't, use faxes and hope that will be okay. He needed to change his approach, and ever since 2016, he started this medicalization reform, really aiming to set specific standards, pharmaceutical standards for medical cannabis, hoping he will be able to handle medical cannabis as any other prescription drug. That's the intent.
And we have seen, and I'm curious if this was part of it. We've seen, at least in Canada for sure, and I have seen in other countries or heard of, I haven't seen it personally, but advocacy groups, people that really are strong lobbyists for patient rights. And for example, here in Canada, there were several groups in the early 2000s and into the before legalization, so 2010 and onward, that were really advocating strongly for medical access and increased medical access. Is that something that was present in Israel as well during this time that you went from the fax in model to where we are today?
Ofir, do you want to answer that?
So I think the answer is yes. There was a lot of pressure, and Tami said that the mindset was changing, and I think that's it. The mindset is changed from this illegal, dangerous drug to something that can be really useful to a lot of patients. There is a policy that runs for elections ever since the 90s, called translated to Green Leaf. Lobbying for legislation of cannabis. That's almost more than 20 years ago. So there was a pressure from the audience.
And I think that also the ongoing work of Professor Meshulam from the Hebrew University gave a lot of validity to this pressure, because again, if in the beginning it was the thought was that these are crazy people or stoned or whatever we all thought about cannabis. It really gave, the idea that cannabis is a serious thing. It gave a lot of validity to this work that was done. So I think that also helped a lot. Besides the lobbying, it's giving some real research into it.
Yeah, it lended and we see that as well here and saw that like that lending that legitimacy to the transition, because it's one thing for patient groups to ask for and to demand it, but when you attach to it the credentialed, let's call it, and strongly researched backing to it, it's really hard to argue against it, and so I think all those things kind of pull together at the same moment in time, which leads me to where are things going in Israel, guys? Like you've mentioned a couple of things on the recreational side and potentially some changes. Are there any looming changes to legislation, or is it just a more robust rollout of the current regulations? What do you guys see, if you had a crystal ball, or if you know something already from things that have been tabled, for proposed legislations? What can we expect potentially over the next year or so for the industry in Israel?
So this is a very good question, and I think the issue in Israel right now is that it's politically unstable. We're facing a fifth elections in the period of 2 years, and the fact that the inability to have a government that really acts and really stabilize the whole market. It's now stable, and again, we're having elections like every 4 to 6 months here. So we hear the not as we had before, like the sidebar parties. We hear more legitimate, the major parties all talk about legalizing cannabis, and it looks like it's going into the consensus, but again, you need really an acting government, not just a government that's in transit the whole time to really enact these laws and make this change. So I think the public is ready and is waiting for legitimating. I think the medical cannabis, I don't think there's going to be another major change. I think the reform is there. That we're going to have small tweaks, as the market needs it. There will be approaches. I think the big change that the public is waiting for is the recreational cannabis. I think as the world is moving towards there, it's going to be easier to make this change here in Israel, and we need the political side to start, to be more stable, and then we may see this change. So that's my expectations for the future. Yeah.
Beer, any thoughts on that?
No, I think, in the last elections, there were really a lot of parties, of course, more than the liberal side, but not only from the liberal side, talked about and, was in favor of legalization of cannabis. But again, it was promises and not action. So it's really hard to tell what future lies.
Well, yeah, I guess we'll have to wait and see until the next set of elections come, and it's a consistent theme that occurs where when countries are you cannot detach it from the political, and it's when at least what happened in Canada, you had a majority government elected, not only but in part had that mandate when they entered, and had 4 years of runway to make it happen, and they did, and now I think it's just too tough to unwind it. So so I think that you guys are right. You make a great point that the political context needs to be stable in order to usher in a robust regime of new fresh legislation. But that was really great. I really appreciate your time, Tami and Ofir, and we'll maybe follow up with you towards the end of the year or early next and see what what's in store then.
Thank you. Thank you. It was a pleasure talking to you.